Most people don't know that Native people in South Dakota have roughly a median age of death at 58 years old, while their non-Native neighbors have roughly a median age of death at 80 years old. And that gap is one of the worst in the entire country. A new report found that Native Americans in South Dakota die from avoidable causes at a rate of roughly 1,100 people per 100,000. The highest rate recorded for any racial or ethnic group in any state they've studied. Those avoidable causes are things like treatable infections, treatable chronic diseases, car crashes, and overdoses. Stuff that better prevention and healthcare should be catching long before it becomes fatal. When you compare those numbers to non-Native South Dakotans, Native people are dying from these preventable causes at roughly 5 times the rate, in the same state, under the same flag. The report ranks South Dakota dead last for Native health, while non-Native South Dakotans are in roughly the 79th percentile nationally in terms of healthcare performance. So this isn't just everyone has it hard. It's a system that works relatively well for non-Native South Dakota residents, but also failing Native people at the same time while cutting decades off of their life. Another problem that arises is that roughly 38% of Native people in South Dakota are uninsured. But the researchers make it clear, even when income and insurance look similar, Native people still have far worse health outcomes. That tells you this, that it's not about having a card in your wallet. It's about whether care is culturally safe, physically reachable, and actually designed to benefit Indigenous communities. One hopeful piece, though, is that South Dakota just passed a law to create a Indian Medicaid Healthcare Task Force, where the tribes in the state will study a tribally managed Medicaid model. In that model, tribes could design care that includes prevention and community-based support instead of just ER visits. That kind of tribal control over Medicaid is already seen in places like Oklahoma, where a tribal investment in clinics, hospitals, and medical education has started to move numbers and healthcare outcomes in a better direction. And this is where I think of the Indigenous School of Medicine idea, which is being pushed by Dr. Donald Warren and others, which I think will fit perfectly into this model. Dr. Warren helped build the first Indigenous MPH and PhD programs at the University of North Dakota, as well as his work right now at Johns Hopkins. Dr. Warren and others have been talking about creating an Indigenous School of Medicine of training physicians from Native communities for Native communities. So now imagine pairing a tribal-run Medicaid system with a medical program and residencies. Center Indigenous knowledge, language, and community realities. I believe that's how you start closing a 22-year life expectancy gap, not just by tweaking insurance forms. The Commonwealth Fund calls these gaps completely addressable, and I agree, but only if coverage, clinic infrastructure, and Indigenous-led training like the Indigenous School of Medicine are all woven together to benefit tribal communities in a healthy and positive way. Like the video, follow the page, have a great day.